Hello, welcome back on Bernama today. You're joining us, Elaine and Jessie, and you're on BNC. Bernama's channel was all about you. Today we're speaking to Dato Aliyah Karen, and she's the CEO of Medicare Charitable Foundation. And today's topic is about Heart Charity Fund as well as cardiac and diagnostics for the B40 group. That's right. Now the government, namely the Ministry of Health, has been trying to reach out and cast the net as far as possible with the aim of providing better healthcare. That's right. To talk about all this and more, we have, of course, our guest, Dato Aliyah Karen, in the studio. Thanks for joining us. How are you?
Most welcome. I got a bit of flu, but I think we're good to go.
Yes, the bug is running around. Yes, I think a lot of people have been. But talking about healthcare, right? Yeah. The Ministry of Health has ascertained that one of the weak points is primary healthcare and public and private partnerships. Right. The focal point is, of course, B40s. Yes. They're the one at the highest risk. Right. They've recently introduced, of course, insurance schemes for them to be able to. But it's still not enough. Tell us about, your move for this charity fund.
Well, all along we've been in dialysis for 25 years. Naturally, most of our patients have been with us for a very long time, and they come under the B40 category. Yeah. We have been subsidizing their dialysis treatments. For those who cannot afford even the bare minimum, we've gone on towards a patient welfare fund program, whereby we use that channel to support especially the B40 who cannot afford even the bare minimum for dialysis treatment. Last year we embarked and we've got the license to operate the first charitable cardiac diagnostic treatment center in Malaysia. Yes, so that was good news because we had been waiting for about more than a year for the center to be approved. The Ministry of Health has been helpful in that sense to ensure that we are like the supporting arm of the ministry in that sense that we can provide assistance, diagnostics, treatments, not treatments that are critical. They would then go to the hospitals, but merely for people to even do the basic necessity health checks, at least the preliminary checks, dealing with their heart and cardiac issues.
That's essentially the starting point, isn't it?
Yes, it is.
Because at the end of the day, a lot of people are not aware of, where to go to, how to get yourself diagnosed.
Correct.
So what did it take for you to put this together? You say you waited for a year.
Yeah, actually we did a feasibility study first, whether there was really a need to set up such a cardiac treatment diagnostic center. I myself didn't know that there was not a single cardiac diagnostic center in Malaysia, so it was no-brainer actually to start this, especially with a lot of people backing this up in terms of the professional cardiologists who wanted this up and running. The chairman and the board of trustees were very supportive, so it was then for me and my team to put this up, and see how we can set up something to assist generally Malaysians who would need treatment but cannot afford private treatment at private hospitals or clinics. Neither can they wait in the long queue at the government hospitals, because we do know that the government hospitals, especially heart centers, they are overwhelmed.
So how then do you assess one whether they get the free service? How do you get them subsidized treatment?
Right, we're doing the same thing that we did for kidney, which we found worked very, very well. Generally, we do not turn patients when they come to us. Excuse me, unless they are patients who are, who are critical, then we would definitely ask them to go to the government hospitals or any hospitals nearby, because we don't handle critical cases. Otherwise, if they are walk-in patients for a second opinion, to do the basic medical health checks, to see a cardiologist, to get an opinion, to run a full blood test, to do stress tests or even an ECG, echocardiogram, CT, which all can be done at the cardiac diagnostic center, then we welcome them. Now, who gets free treatment, who gets subsidized treatment, who actually has to pay for the treatments? We have a social evaluation scheme put into place, a very stringent one, because this is public funded, So as a non-profit, we have to ensure that the money that we collect, the funds, go and are channeled towards the right group of people. So naturally, we we will do a social assessment, including a home visit. We look at their utility bills. We look at even right up to their bank accounts. And if they have nothing to hide, I think, you know, we've had people who even show us J-form bank accounts, etc., etc. And we even speak to the children. If we need to even speak to the neighbors to make sure that, you know, these are genuine cases. After which we then would provide free, should there be a need, or a highly subsidized rate. So that's, you know, that's been working.
How much does it cost? That whole gamut of things that, you know, whether it's the
entire service,
angiogram, or do you have to do the checks, and what are we looking at in terms of the subsidy, as well as, you know, what you
generally I think for the past couple of months we've seen patients come in. We've had 4 angiogram cases, 4 to 5 angiogram cases, and we did our first angioplasty case last week, and we got Serdang Hospital to assist us with that particular case. That case was actually fully funded by MA Medicare, simply because when we did the home assessment, we went through with the patient, we knew that the patient could not afford. We would say one stent at our place to do an angiogram and an angioplasty would be about in the range of 15,000 to 16,000 if you are a walk-in patient.
Wow.
Yeah. So obviously, when you compare it to a private hospital, which would probably go about 35,000 to 40,000 for a one stent angiogram plus angioplasty. So you can see the difference, the gap there is actually already quite big. But then again, there are many people who cannot afford the 16,000. Yeah. So the patient that we had last week with us was one of them who could not afford. So then we had to subsidize. There are patients, even for an angiogram, where we only charge about 2,000 or 1,500, really depending on, you know, their financial situations that they are in, whether they have any other support, etc., etc. So we basically are trying to go 50% of the rates that are in private hospitals. If need be, then more than 50%.
Where is this centre currently situated? You have 12 centres?
Yeah, 12 centres for dialysis. Yes.
So for the...
the cardiac centre is at 183 Jalan Ipoh or Jalan Sultan Azlan Shah, which is, you know, that's where our headquarters is. We have a dialysis centre on the 3rd floor, and we've occupied 2 floors on the 4th and 5th floor for this cardiac diagnostic and treatment centre. It's fully equipped with the necessities that the cardiologists and the patients would need.
How many people does it serve at this point in time?
We've done over 100 patients. We've seen over 100 patients and clients. Some of them just come in to make sure that, you know, their heart's ticking all fine. We do a lot of promotional packages. We've started on talks, which I think it's really very good. We hope to extend these public talks now to the rural areas, reaching out to B40 especially, because I think they're not very much aware of changing lifestyle, healthy lifestyle, you know, those type of things, I think, which we could assist, and if we can, why not?
But to any you know, service like this, the biggest challenge is, of course, cost or
Definitely.
funding. How do you sustain the fund?
Yeah, that was personally my main worry when we embarked on this project, you know. But I think I'll just have to believe that how we survived 25 years with donors supporting kidney patients, you know, I just have to go on believing that, you know, this is a good cause. At the end of the day, if we can work well with the government, we can do more. So that's something that I'm looking forward to, and we're waiting for, you know, the minister himself to come forward to the centre to see the first diagnostic cardiac centre. Our advisor is Tun Mahathir himself. So, you know, I'm hoping that we are able to do more, and more donors will actually come forward to, you know, subsidise or assist, donate and assist these patients who deserve a life just like us.
Where do most of your donors come from? Is it
general public? Actually,
individuals?
Yes, it's actually individuals. We find a lot of you know, friends and associates, and naturally we do have a group of donors who were previously donating towards kidney, has now extended, knowing the good work that we've done. We also do a lot of programs with the media, even with corporate companies, or even a lot of individuals, I would say, have come forth to, give us the seed money or the money, and we are hoping that more corporations and corporate bodies, do the same. And but I would strongly suggest they come by and visit, and then see the work we do. Speak to the cardiologists, speak to the existing patients there. It's nothing like seeing it
firsthand. You've been I was going to ask. You've been doing this 22 years, so it sounds like we have a lot of Malaysians with big hearts.
Yes, Malaysians are generally very generous. You just need to ask.
It starts somewhere. What has been the most challenging part of
I think
your journey?
two things lah. Two things have been. It's always constantly a worry for people like me, and I'm sure many of the heads out there who run NGOs have the same concerns. Firstly, it's definitely the funding. We really don't know what's going to happen tomorrow, how we're going to do. We don't know how much we're going to raise, who's going to work with us, etc. So that definitely that's one. Our aim is to make sure that the centre is self-sustaining in the next 3 to 4 years, just like some of our kidney centres, have is now on a self-sustaining mode.
What do you mean when you say self-sustaining?
Self-sustaining in the sense that over a period of time, with the number of patients that have hit the maximum capacity that we can take, and with the people on ground, sometimes we have local partners and people like that assisting us, we are able to self-sustain the centre in that sense. From the little collection that we do, the fundraising, the events, the donations, we are okay to go. To ensure that the centre can run on its own without having to worry, people like me worrying whether what happens if I don't have funds in the next 2 years. Do I need to close the centre down? So for these centres which are self-sustaining, in the event they are, then, I concentrate on the next one.
It's something sort of like you don't have to worry about. We have a phone number that perhaps you can tell us about that we'd like to share. This is the 0340444468.
Yes,
what is this number for?
This is the general line at the Medicare Secretariat office, and they can, call us anytime if they want to visit, they want to donate, they want to come by for an appointment to see a cardiologist, or even if they want to know more about our dialysis services or what we do, how they can play a role, do call us. We have got every answer in the book of how you can help.
Wonderful. Tell us very quickly about the kids at Medicare and that program.
Yeah, I think it started in 1999. You see, I witnessed a kid in Kota Kinabalu in one of our dialysis centre, and she was waiting for her parent waiting for dialysis treatment to end, and the kid was in a school uniform but having a plastic bag, and literally I think that broke my heart because I don't think, let's put it this way, I decided on that day that every single patient's kid who is with us, we are equally responsible for the patient's children, school-going children as well. So I started this Kids at Medicare program wanting every kid on the first day of school to have a new school bag. So we have extended. Thankfully, that program has done well with lots of donations and sponsors and supporters and even corporate companies who have come forth to ensure that every single year since 2009, we have about 155 to 200 kids. These kids' parents are actually on dialysis. So we provide them back to school kits, from school shoes. Bata was very good to sponsor. CCM did their bid for school bags last year. We've had uniforms, with stationeries from Faber-Castell, etc., book vouchers, anything that we can do to ease the burden of the parents. Because I think that's quite a bit of burden when someone has 4 or 5 kids going to school on the 1st of January, and they themselves are on kidney treatment at our centres. Yes, so we extend even to excursions when you have money, bringing them back during school holidays, just to do a little bits of events.
What would you say is your one piece of advice that you would give to viewers, because you're so accomplished, you've done so much in this space as well. Recently you were also honoured an award at the Women Icon Awards ceremony just last month.
Just a last piece of advice for viewers.
Well, I actually have two, very quickly. Naturally, in my line of work, I would say be healthy, stay healthy, do the simple checks even a simple blood test at least once a year will go a long way. And obviously the second is, again, in my line of work, would like to tell everyone, look, for those of us who are healthy, you know, start giving back. Don't just think of charity, think of humanity. There's a lot out there each and every one of us can do to make a little difference in someone's life.
We'll go a long way. Thank you so much,
right.
Dato Aliyah Karen,
Most welcome.
CEO of Medical Charity Foundation, for your big heart, and also a reminder to all to lend and extend the extra helping hand.
Absolutely. Do what you can, however little, however much. And as you said, you've got health on your side. That is the real wealth. And I think we'll leave you with that.
That's right. Thank you so much for staying to the show. Bye for now. It's been a pleasure.
Yeah,
Thank you.
very nice.
Pleasure so
Thank
much.
you.